Children, consent, capacity and competence. This part of the webinar is all about the Mental Capacity Act 2005. In the previous webinar, we talked about Gillett Competence, which is the legal framework we use for children between the ages of 0 and 15. And in this one, we'll talk about the Mental Capacity Act, which applies to people from their 16th birthday, so 16 and above. I'll start with the 5 Mental Capacity Act principles. Then I'll talk about a few things that can affect mental capacity and how we assess mental capacity. So let's start with the 5 principles of the Mental Capacity Act, and it's a good idea to try and commit these to memory. There's a presumption of mental capacity in people over the age of 16. So by law, any 16-year-old or someone over the age of 16 is presumed to have capacity to make decisions about their own health and welfare. And that is in contrast to the legal framework we use in children under 16. So between 0 and 15, of course, there's no legal presumption that anyone has Gillett competence. It's something that the child has to demonstrate to you, depending on the complexity of the decision and considering other factors as well, such as the age and the developmental stage of the child and the maturity and intelligence of the child. However, on the 16th birthday, the law that starts to take effect is the Mental Capacity Act 2005, which states that there's a presumption of capacity in people over the age of 16. And that is unless it can be established that the person does not have capacity. So the patient who is 16, 17, 50, or whatever age they are over the age of 16, they don't actually need to prove anything to me because they have been presumed to have capacity, but I may have doubts if they have capacity or not. Let's say they have sort of a learning disability or something that may affect their capacity. And in those situations, I need to establish by formal assessment whether that person has capacity or not. And I have to document that and that rationale. And people are allowed to make unwise decisions. So that's people with capacity are allowed to make unwise decisions. As an example of this, let's say we have somebody who has attended accident and emergency department following chest pain, but they want to leave against medical advice and they haven't had the result of their blood test. So they're waiting for the blood test result, but they want to leave against the medical advice. If this person has been assessed to have capacity, legally, they are allowed to make unwise decisions. And as much as we want our patients to wait for their investigations and make sure they're fit to leave, somebody with capacity wants to leave against medical advice. As long as they're fully aware of the situation and the risks, they are allowed to make unwise decisions. Before determining someone lacks capacity, all practicable steps must be taken to support the person to make the decision. As an example of this, let's say I'm assessing someone with dementia and I talk to people who know the patient and they say their cognitive function is better in the morning compared to in the evening. As long as that decision isn't time critical, one practicable step would be for me to assess them at a time of day that they are generally better in their cognitive function. So assess them in the morning rather than the evening. And I'd say that was a reasonable and practical step to take in that situation. If someone lacks capacity, we must always act in their best interests. And sometimes the difficulty is knowing what's in the patient's best interest. So we might have to ask for advice or from senior colleagues, or we need to consider the views of the family, the friends, the carers and people involved in their care who know the patient better. Let's say I'm just assessing someone for the first time who doesn't have capacity. For me to work out what would be in that person's best interests, it would be a good idea to speak to the people who know that person and who knows or has an idea of what that person would have wanted in this situation. And then finally, if someone lacks capacity, we must act in the least restrictive way when we're thinking about their personal rights and freedoms. So how to assess capacity? So it's a good idea to pause the video now and write down what kind of medical conditions or what other situations can capacity be affected. And then if you know the criteria for assessing capacity, write down what 4 things people need to be able to do for us as healthcare practitioners to say that they have capacity. So when it comes to medical conditions or situations that can affect mental capacity, I broadly generalize this into things that are affecting capacity in the short term or temporarily affecting capacity, things like drugs and alcohol, perhaps severe anxiety or acute panic attacks, things that we expect after a little bit of time. The situation is likely to improve. So someone is likely to sober up in a few hours, and then they will probably regain their capacity at that time. And then I think about conditions in the long term that can affect capacity as well. So things like dementia or severe learning disabilities, things that are generally irreversible. So those are two broad generalizations, things that affect capacity in the short term and things that affect capacity in the long term. And for someone to have capacity to make a certain decision, they need to be able to do all of these four things. If they're not able to retain information, but they're able to understand, weigh, and communicate their decision, they don't have capacity because they're not able to do one of these things. So just to make that clear, someone must be able to do all four of these things. They must be able to understand information, weigh information, retain information, and communicate their decision to show that they have capacity. If there's doubts that they are not able to understand information or retain information, then as a healthcare practitioner, we ought to formally assess it and ask them a few questions. So a good way of assessing whether someone has understood and retained information you've just told them is to ask them to repeat back what you've just said and explain it in their own words. So if I've explained something quite slightly complicated, maybe starting chemotherapy, for example, I could say, after a few minutes, can you tell me in your own words what I've just told you, to see if they have understood what you've told them, if they have really retained that information. Whether they're able to communicate their decision or not is generally an easy thing to assess. A simple way of assessing whether someone is able to weigh information might be to ask them to explain why they made that decision to you. So if they said they don't want to go ahead with chemotherapy, then I would ask them to explain why they don't want to have that procedure, or they don't want to have chemotherapy or that intervention, and talk me through the steps they're thinking. So when it comes to mental capacity, we have to think of it as something being decision and time specific. So a person lacks capacity in relation to a matter if at the material time, that's what is meant by time specific, at that particular time, he is unable to make a decision for himself in relation to the matter, so that's the decision that needs to be made, because of an impairment of or a disturbance in the functioning of the mind or brain. So what's the decision that needs to be made? Is it something simple like having a blood test, or is it something far more complicated like undergoing chemotherapy? And at what time are you assessing that person? So when we're taking consent from a patient, that's the time we are assessing the person. So do they have capacity at the time you are assessing them? Don't think about whether they had capacity yesterday because they were under the influence of drugs, or yesterday because they had a seizure. Think about it as, what is their capacity like at the time you're assessing them for the decision you are assessing them? And finally, assessing capacity is not an exact science, which means some medical professionals will disagree whether someone has capacity or not. And that comes down to the fact that you don't have to be beyond reasonable doubt 100% correct about whether someone lacks capacity. Just to explain that in a better way, when I document that somebody lacks capacity, what I do is I assess them against the criteria of being able to weigh, retain, understand, communicate, and then I document what I think the impairment in the mind or brain is. So whether it's due to drugs or alcohol or dementia or learning disability or severe psychosis, whatever the impairment is that's causing the impairment in the mind or brain. Once I've documented my rationale for why I think that person doesn't have capacity, all I really need to say is, in my medical opinion, on the balance of probabilities, the person lacks capacity. And the balance of probabilities is sometimes called the civil standard. All it means is it's more likely than not, which means there's a greater than 50% chance, so anything between 51% and 100% chance there. So there's greater than a 50% chance that the person lacks capacity. So really, when we're talking about the civil standard or this balance of probabilities, we're talking about which side is the evidence in favour of. And finally, it is the responsibility of the practitioner who's performing the intervention to assess capacity. So by this, I mean, if I'm a surgeon and I'm assessing someone who needs an urgent surgical procedure for something life-threatening and time-critical, and let's say the person has advanced dementia and is not able to give me consent because they don't have capacity. As I'm doing the surgical procedure and I'm the person who understands what's involved with the surgical procedure, I have to be the person who assesses that patient's capacity to consent to that procedure. And then if I determine that they lack capacity or establish that they don't have capacity, then I need to document the rationale why and then act in their best interests. If I'm the surgeon, I can't delegate this to somebody else, such as the psychiatrist who has more experience at assessing capacity. Of course, I can ask for advice from people who have more experience and maybe do a joint assessment and things, but ultimately it's the responsibility of the practitioner who's performing the intervention to assess capacity, and therefore we can't just delegate that to other people or assume that other people are correct in terms of their assessment of capacity. So to summarise, talked about the Mental Capacity Act and the 5 key principles that need to be committed to memory. Talked about the criteria for assessing capacity, which is being able to weigh, retain, understand and communicate information. And we talked about some of the conditions that can affect mental capacity. In the short term, drugs, alcohol, acute anxiety or panic attack. In the long term, things like dementia or learning disabilities if they're severe. In the next session, we're going to talk about what actually makes consent valid. And in the final session, we're going to talk through some scenarios and talk through how we can apply the law in each of the situations.